first time of meeting my page or somebody introduce you, please, the first thing you should do is to like the page. Click on the like button. You follow the page, put on your notification bell. It's very, very important because it will enable you to know when I upload video or when I come live like this. I just want to make this brief video so that everybody can watch it. People from Nigeria can watch it. And this is a question that I've been receiving. I am not here to do live. I just want to make this video live so that people will learn. And a lot of you are suffering from this. Please share my videos. Before you ask me question in my comment section, always share my videos. If you are asking me for anything, please, I am a learned person. Write something that I can understand. Sometimes I don't understand the question you asked me. For example, somebody asked me, can you ovulate when you are pregnant? So I don't know how to answer that question. So share my videos. That is the most important thing. Share the video, like this page. I am doing a very great work. Even if you people do not praise me, I will praise myself. A lot of women have conceived through this program. So please, like this page. I want to see 10 or 8,000 likes. Share my videos. And you ask me question, then I'll answer you. Please write your question in a way that I will understand. If you cannot write, you ask somebody who can construct a very sensible question so that I will answer you. So today, I am here to address this issue, also to answer this question. A lot of women, a lot of you are suffering from what is called PCOS. If you have been diagnosed with PCOS, PCOS differs from ovarian cyst. If you have PCOS, you do not have ovarian cyst. PCOS is not an infection. It's a common ailment. Now we are going to look at what this PCOS means. PCOS is ovarian syndrome. It simply means polycystic ovarian syndrome. It is a common condition where you have please share. If you are joining me, I am not looking at the people here, but I am also making this video so that people will come and watch. So PCOS is a common condition where you have few unusual or very long period. It often results in having too much of male hormones called androgen. Many small sacs of fluid develop on the ovaries. They may fail to regularly release egg. I have shown, if you have been following me, I've been showing you guys the pictures of PCOS, and I have been talking about it, how it can prevent you from getting pregnant. So when you have PCOS, it simply means that you have more of male hormones. If you're a woman, it means that you look like a man. You know, men doesn't menstruate, they don't ovulate, they don't release egg. So if you have PCOS, it simply means that you have that of men hormones that is preventing your ovary either to release egg or the follicles from growing. So I'm going to repeat the definition of PCOS. It simply means, or it is a condition where you have few or unusual long period. Some people that have PCOS, they don't have their menstruation. Their menstruation is always irregular. When you have it, it will be long, it will prolong. You don't know whether you are bleeding or you are having your normal monthly menstruation. So when this thing is happening, is, distract your ovary from releasing egg, and this can lead to you having small sacs in your ovaries that cannot release. They will not develop, they will not release. And what is the cause of this? Because you have more of male hormone in your system. So it's a common condition that affects how the women ovary functions or works. This PCOS disorganizes your system. It distracts your fertility, because when you have it, you are not ovulate, you are not menstruating, and I tell you, when you don't menstruate, there's no how you can ovulate, and when you are not ovulating, there's no how you can become pregnant. So PCOS is a common condition that affects how your ovaries, how your wombs function. These little sac that is in your system cannot develop, they cannot grow. So now the three main features of this PCOS is: one, the signs, what you will see, what you will feel, or what will tell you that you are suffering from this is one, irregular period, which means your ovary do not regularly release egg. Remember, I said that in the absence of menstruation, there will be no release of egg. Somebody asked me, can a woman who is not menstruating become pregnant? And I said, no, you cannot, because menstruation is the starting of your fertility of that month. Once you menstruate, after that comes the follicular phase, when the follicle will start developing. When they get to mature, which is ovulation, they will burst and you will release this egg, and this egg will be fertilized by sperm. Then the process of pregnancy will start. But if you are not seeing your menstruation and somebody is telling you that you will become pregnant, the person is lying to you, except if you meet fertility expert who is going to induce your ovaries, who is going to force your ovaries to release egg. But this is in a rare occasion. But if you are not menstruating, just bear in mind that there is nothing like conception. The two factors is polycystic ovaries. Your ovaries become a large and containing many fluid-filled sac, that is follicle that surrounds the egg. If you have PCOS, you do not have cysts. Now, I say polycystic ovaries. These small follicles in your womb that is caused by this is called polycystis, because they are just there. They will not grow. They will not come out. They will just be there distracting your ovary, distracting the function of your fertility. You will not be ovulating. You will not release egg. These are the main factors. Then the next one is excessive androgen. When you have high level of male hormones in your body, such as excess facial hairs or body hair. If you're a woman that you have hairs in your face, you have hairs in your body, you have acne, that is pimples, you are too fat, you are overweight, this could be the signs that tells you that you are suffering from PCOS. And somebody may ask, what are the causes of PCOS? There has not been anything that is identified as the causes of PCOS. Some of them are hereditary. So I am not saying that every woman that has facial hair or body hair is suffering from PCOS. No. If you have been fighting against infertility and you notice these signs I mentioned, it could be that what you are passing through is PCOS. Now, what are the symptoms of PCOS? What are those things that you will notice and you will know? You will see, you will know that maybe what I'm suffering from is PCOS. Number one, of course, is irregular period. Irregular period means that your period is not coming every month, or sometimes you don't see your period. Some people don't see it for years, or sometimes your period is long. Your period that's supposed to last for five days will last for more than 5 days. Then you might be thinking, maybe I have PCOS. PCOS can withhold your period. You can make your period anytime. Like I said before, if you guys are listening to me, I said anytime you are not seeing your menstruation and you have not entered menopause, either premenopausal or remenopause, please share this video. Share. Anytime you are not seeing this, your body is telling you that all is not well. So if your period is longer than the normal days, it could be that you have PCOS. I know fibroid can cause it, ovarian cyst can cause it, and what next? Endometriosis can cause this. But at least if you see this sign, you will know that you are suffering from either of these things that I mentioned. Irregular period. Your period is not coming every month. Your period may come 3 times in a year. Your period is prolonged. Then the second one, which is obvious, is that people that have PCOS, they find it difficult to get pregnant. Do you know why? Because they are not ovulating. Because of this sac-filled cyst in your womb, They will not, I say sac follicles in your womb. They will prevent you from ovulating. In the absence of ovulation, there is nothing like conception. Another thing is excessive hair growth. You see a woman, you have hair all over the places that men have, like here in your chest, in all over your body. This is the sign of PCOS. Overweight. People with PCOS, they are always fat. They are always fat. And loss of hair and thinning hair is also the sign of PCOS. Now, somebody may ask, what is the cure of PCOS? PCOS does not have any cure. It is you. There is somebody that I was chatting with yesterday. You send your test, and in that test, a lab test, please, I said, if you have any issue, visit your gynecologist. He will be the one to prefer a test for you, so that when you go for this test, he will analyze it and he will give you prescription. Please, nobody should send me any test result either here or in my messenger. I am not your doctor. Your doctor is supposed to be the one. You may go to the lab to do tests. What is their business? They will conduct the test. They themselves, they are not even allowed to interpret anybody's test. Their function is just to conduct the test, and they will give it to you. You go back because they believe that before you come to do any test, that it might have been prescribed by a doctor. So you cannot just walk to lab and you go and do tests. When you come and send it to me. Please, I don't want that again. Before you go for the test, meet your doctor. Your doctor will prescribe a test. I don't know why people are afraid of visiting their doctors. And a woman, as a woman, regardless of whether you want to conceive or not, every woman is supposed to be visiting their gynecologist 2 times in a year. Every 6 months. Myself, I go 3 months. Do you know the reason why? Some of these issues, infertility issues, is because we don't visit. These ailments, they will start. By the time we go to the hospital, they have escalated. They have become worse. They have become you cannot treat them again. But assuming you are visiting your gynecologist to check your uterus, to check your vagina, all these things will be trashed out. They will be detected early, and it will be they will fix it. Don't wait until when you want to become pregnant before you visit your gynecologist. Every woman, for example, if you have infection and maybe you don't know, before you go and meet your doctor, the infection has become worse. This small organ. So, the treatment for this polycystic ovarian syndrome, that is PCOS, is doesn't have treatment, doesn't have any medication. The only medication is this: you putting yourself in a diet. Watch what you eat, avoid dairy food. Watch what you eat. If you are fat, try to reduce weight. Some doctors will give you some medication. This medication cannot cure it. What they will stop is the signs like pains. So I'm going to stop here. My baby is crying. If you have any question, ask me.